All right. Thank you, everybody, for attending today. We have a very timely topic, but I think we'll discover that the time has come and passed for the last several years when it comes to the HIPAA security rule. Today's topic is no final rule, no excuse. I'm going to help you guys, hopefully, to build some HIPAA security readiness now, and not wait for anything quote unquote official. So here's kind of our roadmap for today, what we're going to go over. So we're going to talk about what happened to the proposed changes, right? So there was the HIPAA security rule proposed changes that were supposed to have gone through this summer, and they did not. So we'll
Oh,
talk
real
about,
quick, I
yeah.
can't see your screen if you're showing your presentation.
Oh, really? Oh, what can you see?
Just your face.
Oh, well, it'd probably be helpful if I shared my screen. That
Sure.
usually does it right there. Okay. How
Okay.
about now? Good?
Um, yes. Yep, we have it.
Okay. Sorry, Josie and I are just falling apart today, apparently.
Yeah, apparently.
Hang on. All right. So here's the roadmap for today. What happened to the proposed changes, OCR enforcement. So we're going to look at, okay, what is the OCR? And that's the Office of Civil Rights. What are they actually enforcing? What can we learn from that? We're going to talk about their risk analysis initiative, their cybersecurity newsletter that they sent out earlier this year. And also, they had a risk management video in April that they published. All of those things are going to give us clues into where we should be focusing our efforts. So, even without a final rule on some of those rewrites to the HIPAA security rule, the OCR is, I think, making things pretty clear on where they stand and how they're interpreting the current rule as it stands. And then we'll go over a 90-day action plan to hopefully help kickstart things if you're kind of like, oh my gosh, this is a lot, to give you a little bit of practical guidance. So, first up, we have, of course, what happened? What happened to the rules? So it was kind of an interesting thing. There was, all of this talk around the HIPAA security rule. We were getting so many questions from clients on what's going to happen with this. What do we need to be thinking about? And we were all just kind of sitting back going, I don't know. They're really not saying anything. HHS is kind of being quiet. Well, in the same vein, they were equally as quiet when they decided to move the proposed rewrite to July of next year. So what they actually did is they didn't do any sort of like official news release. They just quietly updated this regulatory tracking website, which is reginfo.gov, and people started to notice that that date had changed. And so I kept seeing all these posts on LinkedIn, final rule pushed back to July 2027. And I'm looking through my emails, looking at all my normal places, going, what? Was there a news release? Did I miss something? And it was just, no, it was just a quiet change on a website that clued us all in that, okay, things are getting pushed back. So if you kind of saw, those whisperings, saw people talking about it and thought, oh, good. One less thing to worry about this year. Don't need to think about the HIPAA security rule. Don't need to think about any of those proposed changes. Well, then this webinar is for you because that reaction is actually just a little bit backwards. And I'm going to show you why. So how did we get here, right? Back in the end of 2024 is when the OCR issued the notice of proposed rulemaking, which would have substantially rewritten the HIPAA security rule. In January of 2025, the proposed rule was formally published in the Federal Registrar. So this is the normal progress of these things, of when these rules get introduced or changes to the rules get made, so they're following the normal process. In that process, once it's published in the Federal Registrar, then people can actually make comments. You can, I can, anyone can go on there and say, hey, this is what I think about this proposed rule, this proposed rewrite. And so that comment period opened in January of last year. It's a short window usually. So then March, the comment period closed. OCR received nearly 5,000 public comments, many objecting to the cost and timeline of implementing all of the changes that they wanted to make to the HIPAA security rule. That is a ton of comments. I'm actually surprised there probably weren't more, but I think probably a lot of people don't realize you can make comments on those things. And I do think that the OCR or whoever it is, they do take those into account. Now, they might still go about their business and do what they wanted to do in the first place. But the whole point of that is to receive public feedback, to receive feedback from the people who the rule will actually affect. That's how our government should work, right? So then we jump forward because basically from March of 2025 until really this year, really July of this year, we weren't really hearing very much. Things were very quiet. We kept looking, kept searching. People had thoughts and ideas about, oh yeah, it's definitely going to get rewritten this year, or nope, I think they're going to throw the whole thing out. There was just a lot of talk, but not a whole lot of actual evidence as to what was going to happen. So again, then in July, HHS updated that website and moved it into being formally published in the comment period to now a long-term action. So the new projected final action date is July of next year, and we'll kind of talk about what that means in reality. So why do we think this delay happened? There's lots of opinions, lots of thoughts out there, but this is really where most people are landing. So first thing is that that proposal was genuinely sweeping. It really would change a lot of how people approach the HIPAA security rule, whether good or bad, right? I mean, I think when the HIPAA security rule was first enacted, a lot has changed security wise. When we think about cybersecurity and all of that, a lot has changed, and the rule really is behind, right? So there probably are some updates that need to be made, but it was a lot. It was quite a bit, which we'll talk about. HHS, they even admitted their estimated cost that they thought it would cost the public, cost healthcare providers in that first year on average or total for first year cost would be $9 billion. That's a huge lift, right? And I'm sure most of you on this call, whether you're in a practice, whether you are a medical billing company, if you looked into what the rule would require, probably most of you saw dollar signs, right? And time. So HHS admitted it was going to be costly. Another reason why we think it was delayed was because of the comments, especially from smaller rural providers. They basically argued that the implementation timeline was unworkable. It was more like a one size fits all approach and really ignored, the size of your practice or the resources that you have available to you if you're a smaller provider, even if you're not a smaller provider. Larger providers, hospital systems, they might have more dollars, but then that also means it usually costs them more to implement anything as well, right? So the cost wasn't just a concern to small providers, but also large organizations as well. The thing to keep in mind is the regulatory agenda dates are just planning estimates. And so although they said that July 2027 is the proposed new date, they could literally come out tomorrow and be like, oh, okay, here's all the changes we're making, and you have 180 days to get in line. So just keep that in mind that although it got pushed back, that date could change at really any moment. And then here's also another thing that OCR is saying is that the HIPAA privacy rule is actually the priority for this year. We are supposed to hear about those changes. I mean, some of the early estimates were this month, but I'm looking at the calendar thinking we have 5 more days, so we'll see if that happens. But for sure, this fall is when they're saying there should be some more guidance on those privacy rule changes. I'm sure we'll probably do a whole webinar on that. There's not maybe as many changes as far as like it's not a complete change to the HIPAA privacy rule, but there's definitely some things that if they pass, logistically for your practices, you'll have to keep them. So all that to say, the delay was because of public reaction to the cost, to the resources needed, to the timeline. And then they decided just to focus on the HIPAA privacy rule for the rest of this year. And then we'll see what happens with HIPAA security rule next year. But all that to say, the OCR, again, that's the Office of Civil Rights. They're the ones that make sure that HIPAA is being followed. They do not need a new rule to enforce what already exists. And I think that's where people are getting caught up a little bit with the kind of laid back approach of like, oh, okay, I don't need to worry about this till next year. The problem is that the OCR is already communicating pretty directly through enforcement actions and other things that their interpretation of the security rule already kind of put some of those things into effect that they want to put into actual black and white law. So again, the HIPAA security rule, it was finalized in 2003. That's crazy how long ago. Took effect in 2005, and then it was amended in 2013 to include, business associates having that direct liability as well. So a lot has changed, right? The cybersecurity landscape, the rate of ransom attacks and all of that has jumped significantly since 2003 for sure. And even in the last just, I feel like 10 years, it's gotten really, really crazy. The deal with the updates to the security rule is currently the security rule kind of divides things in two categories. There's the required parts of the security rule, and then there's what they call addressable. So this is where the huge rewrite would have come in, is that almost everything that was in the addressable column would get put in the required column. So them basically saying, yeah, none of this is addressable anymore. We really just want all of these things to be required. That is a very big distinction. There's very few exceptions to that. So we're just going to take a quick look at what the rule currently states as far as what's required and addressable. I'm not going to go into each and every single one of these. That probably do a whole webinar on every single bullet point. Um, but just for a quick litmus test, like think through these things. These are the required, meaning if you are covered under HIPAA, if you are a covered entity, a provider, if you are a business associate, a medical billing company, an RCM company, a medical device company, these things currently are required within the HIPAA security rule. You got to do a risk analysis, risk management plan, sanction policy, workstation use policy, device and media disposal protocols. You need to have unique user identification for people who are accessing the PHI that you are in charge of. You need emergency access procedures and so on. Each of these things, even within those bullet points, have other like sub bullet points, right? Then we have the addressable column. I want to stress, and I know we've probably said this on every single webinar that has to do with the HIPAA security rule or anything around it, is that addressable does not mean optional. Um, Addressable means flexible. So an organization needs to look at these things that are addressable: workforce authorization, termination procedures, having keeping maintenance records, having automatic log off on your devices. Encryption is still in the addressable column, and making sure that ePHI, that the integrity of it stays intact. So when they're saying addressable and I'm saying not optional, it's because you either need to implement the specification as written. So if you went straight to that law and it says, here's what you need to do, you either need to do exactly that, or you need to adopt an equivalent alternative. Okay, so um, one example that I like to use, and I'll probably use this example throughout this webinar, just because we do get a lot of questions about encryption. So let's say, for example, under the addressable column, it says you need to have encryption, right? You need to make sure that all ePHI is encrypted. Well, let's say you have an email, within your organization that everybody has their own email account. So within your EHR, you have a messaging system where you can message each other within the EHR. It's in that safe encrypted environment. There's a lot more safeguards around the EHR software. And you decide that, okay, for email, we're not going to require encrypted email because we're not going to let our staff email any PHI. The email is, for maybe communicating with other people, but we're not going to actually put any actual PHI in it. Well, that would be a way to look at the addressable guideline of encryption and you're deciding our safeguard we're going to implement is that we don't allow PHI to be emailed. And so we don't need to actually encrypt the email. So again, it's kind of case by case. What they want to see is that for the size of your organization, the complexity, the risk profile of what you're doing, that you have put the appropriate safeguard in place to meet this obligation. Addressable, again, is more like flexible, not optional. All right, so here's how a lot of us felt when we saw the delayed rule. Kind of sat back, thought, oh, okay, I have another year to worry about this. Don't need to think about it. But then we got this like creepy little guy coming in through the office from OCR that is saying, hey, none of this really matters that the HIPAA security rule has been delayed because I still expect a whole lot of things from you, even if they are not explicitly stated within the security rule itself. Um, you know how this is like the analogy that I keep thinking of when you're like reading or watching a thriller or a mystery, and you're watching the whole thing. You get to the end and you finally figured out what happened, and you think to yourself, "Oh my gosh, if I would have been paying closer attention to all of these clues throughout this movie or all the clues throughout this book, I would have totally been able to figure out what the final outcome was going to be." Right? But you don't realize you were supposed to be paying attention to small details and maybe sometimes even larger details throughout that narrative that gave you clues to what was actually going to happen. So I keep thinking about that with this HIPAA security rule because I'm like, all right, they said the rule is delayed, but throughout at least the last year and a half for sure, if not longer, we've been getting all the clues that we need. OCR has been making it very clear where the expectation is and the things that they are enforcing. And so try to think of it in that framework. We might not have the end result yet, but we sure should be paying attention to the clues that OCR is giving us along the way. All right, first we have our first polling question. So I'll have Josie bring them up. But when did your organization last complete a full HIPAA security risk analysis? So here's your options. Within the last 6 months, 6 to 12 months ago, over a year ago, never, or unsure. It might be someone else's job. You're unsure when it was last completed. But go ahead and make your selections. I'll give you guys a couple of seconds to decide, or you can always put unsure if you're like, I have no idea. All right, Josie, how are you looking?
All right, I'll end the poll. All right, there are the results.
All right, not too shabby. All right, within the last 6 months, 33%. 6 to 12 months ago, 43. Over a year ago, 3%. Okay, nobody said never. I love that. And maybe it is never, but you didn't want to have to click that answer. That's also fine. Unsure. Okay, no worries there. You might want to ask, make sure somebody in your organization is handling that task for you. And if not, maybe you've just elected yourself as the new compliance officer. All right, so everyone pretty much usually is all over the place. Even when we get clients, sometimes we have clients who, yep, we just did one, or no, we've never done one, or yeah, but it was a couple years ago, probably need to freshen it up, right? So the reason I'm asking about the HIPAA security risk analysis is because this is one of the things that OCR is making very clear, and we're going to break it down further as we go along. But if we look at the OCR enforcement actions, since the beginning of 2025, there have been almost 30 HIPAA enforcement actions. That might not seem like a huge number. You're like, okay, only 30 organizations, have had an enforcement action against them. Those are the big ones, right? And those are ones that make the news. There are lots of little mini investigations going on all the time. If you look on what we call the OCR wall of shame, you can see all of the breaches that have been reported. You can see their status of them. And you always have to keep in mind that the government in general runs a few years behind, right? So a lot of enforcement actions that we're getting now were actually from things that happened like 3 years ago, 4 years ago. It'll be really interesting to see, with like Change Healthcare and all of that. At what point will we get more information? At what point will we see how much they're going to be fined for that huge breach? But really, before 2019, the focus was more on general security, privacy rule violations, and then there was a huge shift in the early 2020s. And then an even bigger shift in October of 2024 when that risk analysis initiative came into play, which we'll talk about in just a second. But again, all of these trends, and I'm going to go through the three for now on the screen, they're showing what the OCR expects, and it's really a lot of times an extension beyond just the written rule. So if you think about the rule as maybe being black and white, and then there's like the spirit of the law, and they are taking liberties with the spirit of the law. And partly they kind of have to, right? Because as we said, since 2003, a lot has changed in the cybersecurity space. Um, we all feel it, even in our own personal lives, right? So one of those first things is encryption. So you'll remember it was in the addressable column, but what we're seeing in enforcement actions is it is being enforced as a de facto requirement. We had a organization in 2019 who had a $3 million settlement over a lost unencrypted laptop and flash drive. OCR cited that the organization did not employ a mechanism to encrypt and decrypt the electronic PHI when it was reasonable and appropriate to do so. So even though the HIPAA security rule does not explicitly say that you have to have encryption on things, that was the expectation because OCR looked at that and said, well, this was reasonable and appropriate for you to do. And that is part of those addressable requirements is deciding what's reasonable and appropriate. And they decided for that organization that it should have been in this instance. And so they got a $3 million fine. Um, Encryption is one that we keep telling clients, like, don't sleep on it, right? Just because it's in the addressable column, or at least have a really, really good documented reason for why you're not encrypting something, like my email example, which in reality, if you have an email, are you really not sending PHI through it? That's actually really, really hard to do. So while that's a decent example in the reality of your practice of your organization, it's really difficult. So the better option is to encrypt. The next thing that we've seen is online tracking. That has become huge, not just in the healthcare space, but in every industry, I feel like. But online tracking. So the enforcement of online tracking technologies from the OCR has been entirely just in guidance bulletins. They've had no rule, no official rewrite that's including online tracking technologies at this point, but they've put out guidance bulletins and they are enforcing what they've put in those guidance bulletins. Again, they're taking the black and white law and they're infusing the spirit of the law into it. So with the tracking technologies in 2022, OCR issued a bulletin declaring that regulated entities, again, covered entities, business associates, are not permitted to use tracking technologies that would result in impermissible disclosures of PHI. So that was asserting that IP addresses connected to health-related web page visits count as PHI. That's crazy. It makes sense, right? In March of 2024, the OCR updated that, also narrowing the definition slightly because they had an active enforcement against covered entities who were using Metapixel and Google Analytics on patient portals. They were using pixel tracking and they were starting to dole out fines. I think since that time, so since middle of 2024, the settlements for just those analytics, just that tracking technologies has exceeded over $100 million across litigation and OCR action. So that's something to keep in mind. Again, it doesn't explicitly say these things in the HIPAA security rule, but they're taking the idea of you must protect PHI and they're having to figure out how to apply it with all of these new technologies, all of the new things that we have available to us out there. A lot of marketing companies use the tracking technologies. I mean, you see that every time you add an app to your iPhone, it says allow, app to track. And I'm always like, no, don't track me, right? Like, I don't want to be tracked on everything. But you don't realize every time you go to a website, your activity is being tracked. They want to see who is clicking on our website, how often are they clicking on it. So again, OCR is having to take some liberties with what is actually written. Interestingly enough, in June of 2024, there was a Texas federal court who vacated part of the guidance that the OCR put out because providers sued the OCR and they were upset because the OCR was enforcing things that had never gone through that notice and comment rulemaking piece. So when I showed you kind of that timeline of how we got here, that part where they publish something and then they allow the public to make comments, OCR just bypassed that with these guidance bulletins. Now, a lot of that tracking technology guidance is still there, but they did backtrack a little bit on it um, just because it was recognized that, like, hey, you can't just start enforcing things. But again, they are, that's at the end of the day, they're still enforcing a lot of things that are not explicitly in the rule. Another thing is recognized security practices and NIST alignment. Not sure if you guys have heard of NIST. It is a huge cybersecurity guidance out there, not just for healthcare, but they really set a lot of the standards for what the expectation is. And what we're seeing in enforcement actions is that the OCR expects to see that you are aligning with some of these organizations. So whether that's NIST, whether you're doing SOC 2, some of those other kind of certifications, which we'll also talk about the downside to those. But OCR wants to see that your organization has a recognized security practice. So if you can say, hey, we follow the HIPAA security rule, and we also have aligned all of our organization with the NIST guidance, then they are actually allowed to, by Congress, to lessen your fine. So we saw that in an investigation where they could demonstrate it was a let's see what was it a medical institute. They could demonstrate that they did have a recognized security practice, and so OCR reduced their fine by 20% just because they were able to demonstrate that NIST alignment. um, on the flip side of that is we've had other organizations where they weren't able to demonstrate that, and they actually cited that as one of the reasons for the enforcement action was that the practice could not show that they had any sort of alignment with any recognized security practice. All right, up next we have the risk analysis initiative. So again, all of these things that I'm showing you today should be kind of like little light bulbs in your head of like, okay, these are things I need to be paying attention to because this is actually what the OCR and a lot of what your business partners will also be expecting. So whether or not you work with business associates, you work with other vendors, it's becoming more and more common that people want to know what your security structure is. So again, all of this is all those clues, all those pieces to the puzzle. So risk analysis in October 2024. Here's what the goals were. They wanted to increase completed investigations. So OCR is trying to have more investigations. They want to make it very clear that this is important. They care about this. This initiative is highlighting the security risk analysis requirement. They also want to see, and this is something we're going to expand upon even more, is they want to see action on risks, not just identification. So they're like, okay, great, you've identified your risks. Now we want to see what you're doing about it. They also want to cover the full EPHI life cycle. So they want you to be able to show that you know where your EPHI lives, how it flows through the systems, where vendors or third parties are introducing risk into your organization. And then they want to see that you've tied that back to the safeguards that you're actually putting into place, and do they make sense? One thing that's interesting about this initiative is it seems to be an enforcement priority, not a one-off campaign. Part of the reason we can say that is because this initiative started back with the Biden administration, and obviously now we're in the Trump administration, and OCR is still going with it. There has been no pause. There has been no clawback of like, yeah, that's not a priority for this administration. It has continued between two administrations, which does not always happen. That's also another reason we might have seen a little bit of a delay in the security rule, is that all of those rewrites were during the Biden administration, and the Trump administration just has either different priorities, like the privacy rule that they're going to start with. So that's important to note, that this looks like something that's going to stay. And I think this last bullet point is exactly why. It is because an inadequate risk analysis has been in 90% of the OCR's enforcement actions. So when you read about those enforcement actions, they say the major things, they don't always go into details, right, about what they found. 90% of them say that the organization did not complete a adequate or thorough risk analysis, and that was a major factor into why they are being fined, why they're having to have a corrective action plan, and all of that. So here's the HIPAA violation trends. I kind of already talked about these, but just showing you kind of the changes, and also the, amounts have kind of gone back and forth, probably for various reasons, but the cybersecurity focus, the risk analysis focus, the risk management focus has really been the thing focused on for the last several years. So what is the risk analysis process? I'm just going to quickly go over this just in case you're like, okay, what does this actually entail? So scope and gather data, right? Figure out what's the relevant data, what do we need to be looking at, what softwares, what servers, what access points. You want to identify your risks and gaps. So find those potential risks, threats, control gaps, assess and rate the risk. What's the likelihood of this risk occurring, and what would the impact be on your organization? So like one of our things that we look at is, like a phishing email. What is the likelihood that someone in your organization is going to click on a phishing email? And then if they did, what impact could that potentially have on your organization? So that's one way to kind of evaluate different risk levels. Next part of the process is you want to document and plan the fixes. Again, what OCR is saying is you can't just identify the risk without then putting a plan in action to mitigate the risk. This is not necessarily get rid of the risk forever, because some risks are always going to be there, but hopefully you can keep them lower, especially if you have a high risk thing, bring it down low. And then the fifth part of the process is to fix and then monitor and repeat. And you see my little guy there with just the constant circle. That is your risk analysis process, should be just this like thing, this revolving thing that just keeps happening, keeps happening. Especially when you have new identified risks that enter the scene, new vendor, new tool, then the whole process kind of starts again. Here's the kicker. In the HIPAA security rule, it says that you must conduct a thorough and accurate risk analysis. And that's all it says. So then, you know, people come to us, clients come to us, and they're like, what does that actually mean, right? What is a thorough risk analysis? Again, we're going to look at the clues. We're going to look at the things that the OCR is pointing out as flaws, as red flags, as gaps in these analyses. And that helps us see what that thorough risk analysis actually. One of the things that's not explicitly mentioned, itemized asset inventory log tied to the risk analysis. So what does that mean? That means you need to make sure you know what all of your assets are that hold PHI, whether that's a server, a laptop, a cell phone, an iPad. All of those things should be accounted for. Cloud storage, that's one that gets missed a lot. People think, oh, it's in the cloud, it's totally safe, I don't need to analyze it. That is not true. Anything that is accessing, storing, sending ePHI, maintaining it, you want to have it logged. The next thing up is a documented ePHI data flow map. Okay, they want to see, do you know where your data is flowing? So let's say you start in one spot. You're like, I'm starting in my EHR. Okay, where is the data flowing from there? What are all the different exits from that EHR. That could be to a billing company, that could be to a coding vendor, that could be to an email vendor, an eFax vendor, a clearinghouse that's then going to process your claims. You want to be able to show, where it starts and where it's all going so that you know where your patient's PHI is or your client's PHI. If you're a business associate, you should have a data flow map. Another thing that is being cited in these enforcement actions is vulnerability scans and penetration tests. The interesting about this, again, is not explicitly mentioned in the security rule itself, but OCR considers this an operational interpretation of what accurate and thorough means. You want to make sure you're doing those vulnerability scans and penetration tests at least on an annual basis, possibly more often, depending on the structure of your organization. But this is an expectation, and it's an expectation that this is part of your risk analysis. The next thing is networks segmentation. So there was an enforcement action where like segmentation was not happening. So the corrective action plan for it was a Star Group Health. They wanted documented review of all their controls involving network segmentation, infrastructure, logging, and alerts and patch management. So this organization didn't know where any of their PHI was. They didn't have their networks kind of in tight little boxes. They weren't sure who was logging into what and when. It was kind of a mess, but they want to be able to see that you can look at kind of each network and know, who exactly is accessing it. Are the right people accessing it? Not that everybody in your practice or organization just has access to everything because it's easier. And then the last thing was they wanted to see assigned accountable owners and remediation timelines for every risk. So when you have the risk analysis, in theory, you do the risk analysis, you do your threats and vulnerabilities, and then you have your remediation plan. Now, that remediation plan shouldn't then just be like, oh, all right, let's put that in the desk and worry about it later. You need to have an accountable owner for each of those things that you identified. Who's going to be in charge of mitigating this risk? Who's going to be in charge of this remediation plan? And every risk might have a different person on it, right? Depending on what side of the business it intersects with. All right, next clue that we were given was in January of 2026, OCR sent out a cybersecurity newsletter. They said at some point they were going to be sending out these newsletters quarterly. It hasn't quite happened that way, but it is a free newsletter. It's usually short, and I think almost nobody reads it except for maybe all of us here at HCP because it's just, what we do. But you should read it. You should definitely go read it because again, this is outlining the expectation. And it's explaining how they're applying the rule in real time. I'm going to attempt to summarize what this newsletter entailed without getting too technical. Obviously, it's cybersecurity. There's a lot of IT jargon, IT words in there that I'm not in IT. I don't even necessarily love reading about those things either, but I do care about, okay, how do they apply to me? How do they apply to my clients? How can we help people understand, like, what are they supposed to do with this? So first up, in this newsletter, patching is required, not optional. Patching, what is patching? Well, when I think of it personally, I think of, okay, on my phone, whenever it says that you need to do a system update, there's some sort of update that Apple has sent out, and I hit ignore, 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 because I really don't want to mess with it, shutting down my phone for a few hours, or it's always at an inconvenient part of the day. Well, that's what a patch is. So all softwares, uh, different technologies, when they identify, like a bug or some sort of security gap, their only way to really push that out to the public is with some sort of update, and you can run them automatically, right? Your computer might automatically run, say, Microsoft updates. Your phone can run them automatically. But that is what patching is. So OCR called out that unpatching is a vulnerability, and they saw it as a reoccurring root cause in many investigations. So what they expect is we talked about that asset inventory list, right? An updated one, because if you don't know what devices and softwares and stuff you have, you don't know how to track if there's been any recent patches that need to be implemented. They want you to monitor NIST and CISA alerts. So again, those are some of those security frameworks, and they stay pretty up to date on, hey, Microsoft just launched a huge patch that everyone should do. You want to make sure you do those vulnerability scans because those can find when patching either hasn't worked or hasn't occurred. And then you want to document. You want to document that this patching is happening, that somebody is tracking this, whether it's even just on a spreadsheet. It doesn't have to be anything super fancy, but someone needs to own this in your organization. Legacy systems, these get people every time. So those legacy systems, I had this happen to me also with an iPhone at some point where I was like, I don't want to get a new one. I'm just fine with the one I have. Well, eventually, Apple just stopped sending updates for it, and I couldn't use my apps, and I couldn't use really anything on it, and I had to get a new one. So we have similar things like that in our organizations, right? We have old devices that we're still using. We have old servers that probably need to be replaced. And sometimes those patches, those security updates aren't even going to work on those older systems. OCR is saying that that is not an excuse. You need to either update your things or you need to disable unnecessary services. So let's say you have a legacy server, for example, something that's old, you still have it because it still has lots of PHI on it and you don't want to just get rid of it. Um, but one of the things that you can do is, okay, currently, let's say that server that 20 people in your office still have access to it because they were given access, 10 years ago and the access was never taken away. Well, that doesn't make sense anymore, right? Nobody needs to be actually using that system. You probably just need one admin password so that if you need to extract data from it, you can. So you can tighten those access restrictions to hopefully keep unwanted people from getting into that legacy system. You want to have enhanced monitoring with legacy systems because you can't put as many controls in place a lot of times. You want to really watch who's getting in and out of those legacy systems. Some things you can put in place are like restrictive firewalls, adding multi-factor authentication if the system allows it, depending on how old it is, extra anti-malware, just to catch things because those legacy systems just usually aren't up to snuff and hackers know that and they will use it. Third thing is unused software and default accounts. So these are a hidden risk because you don't think about it. These are things that are pre-installed on devices. It could be games. It could be different legacy services like remote desktop protocols. They come with default admin accounts, right? Those things need to be looked at because hackers know how to get into those things because they're so standard. They're standard on all devices. You think about those admin accounts that come with a generic password. Those are the access points that hackers are going to try first because that's easier. It's usually not a unique password. So how do you deal with this? Change those weak passwords, uninstall things that aren't needed. Uninstall those games. They don't need to be on the computers. Uninstall any legacy services that aren't needed. Don't accidentally delete anything you need for your computer because that's also happened before, but make sure you have someone that knows and can go through your systems and be like, yeah, we don't need this, we don't need that. Um, Part of that is because when you have all of these things on here, it widens your attack. The more kind of junk you have on your systems, on your devices, that is more access points for bad actors. Fourth thing is controls must be enabled and configured. So your systems might have all of these abilities, all of these safeguards, all of these things that help you control access or help you control people from getting PHI that shouldn't. A lot of times you just haven't implemented them. So make sure you're not wasting time purchasing things that you're never going to implement. Things like multi-factor authentication. Is it available? Have you bought the program with the extra securities? Make sure it's all enabled. Same with encryption and make sure that's enabled correctly. One thing that I like to mention here, because it comes up a lot, is, I have clients that say like, oh, we have Google Workspace, which is, they say that's HIPAA compliant. Perfect. Did you know that Google has a 26-page HIPAA implementation guide that if you buy their enterprise, level that says it's HIPAA compliant, they don't configure it for you. You have to go through that implementation guide and make sure you put all of those configurations in place in order for it technically to be HIPAA compliant. Um, so keep those things in mind. Just because the control exists does not mean it has been enabled or configured properly. Make sure that you're doing that. The fifth thing they mentioned in the newsletter was security baselines are encouraged, not checkboxes. This is again back to NIST, back to like Microsoft has security baselines also. What they want to see is like if you're using these things, NIST guidelines, Department of Defense, those are all great. Those do not equal HIPAA compliance necessarily. That's not usually their, not, it's really not their priority. They're putting all of those frameworks out there for like just the general industry of people, all the different types of industries. So you need to make sure that while you might have NIST guidelines in place or CISA guidelines in place, that might not be completely covering you for all the HIPAA security rule. So make sure that you have tailored those things to what you actually need. Last thing on the newsletter is test before and after every change. So when you add a new software, when you add a new tool, let's say an AI tool, something like that, see if you can do it in a test environment first to see like, okay, have we tightened up all the access points? Do we have all the proper security protocols in place? Did we follow the implementation guide to make sure that it covers everything we need for HIPAA? So don't just add things and just like deploy it without making sure that it actually works. All right, next polling question. Which of these six OCR findings hits closest to home for your organization? So, in other words, which one are you most concerned about? Patching software, legacy systems, unused software, unconfigured protocols, security baselines, testing, new things. So, go ahead and pick which one you are most concerned about. All right, Josie, do we have some good feedback?
Yes, let me end the poll. All right, there are the results.
Okay, a little bit all over the place. That's kind of what I expected. Just everyone kind of has their own things, and you might have been like me a long time ago where I was like patching, like what do I need to worry about patching for? But then I realized, oh, those are all the things I ignore on my iPhone that I should probably now do. So yeah, that's everybody. It's actually almost pretty equal besides the testing piece. So that's about what I expected. So yeah, if you are concerned about one of these areas, hopefully when we get to the 90-day action plan, it'll help you. But I also would just go and read that OCR newsletter, and then kind of look through it and be like, okay, how does this apply to us? How can we use this to make sure that we are in alignment? All right, next clue the OCR has given us is in April, instead of a newsletter, they published a risk management video. It is not entertaining. I don't know, this day and age with technology out there, it still amazes me sometimes that the government can put out such boring videos. I'm sorry to the person who made the video. It was rough to get through. You can speed up the, timing of the talking so you can get through it a little bit faster. But they basically put out this risk management video. I'm going to give you a summary of it. So if you don't want to go watch it, again, I encourage you to watch it. Here's the summary. Here's what they focused on. First was risk management is a distinct separate requirement. So from that risk analysis initiative that they put into place, that a lot of times was just kind of looking, did you complete a thorough risk analysis, right? Well, then they started seeing a huge gap. They saw that, okay, these people sometimes have identified their risks, but then they did nothing about it. We have that a lot with clients. We have clients that come to us after they've gotten in trouble with OCR, and they might have already knew about a risk, but then they just didn't follow that like second to last piece of, okay, how are we going to manage that risk? So they made it clear that that is a separate requirement, something that they are going to be looking at. Again, this is that second point. They're formally expanding that initiative. Identifying the risk is not enough. You must show how it was reduced. Risk management is a prioritization exercise, not an all or nothing. So risk management is, high risk, medium risk, low risk. There might be different terminology for it, but it's all kind of on that like gradient, right? Where if you have something that's a low risk, you might be able to wait and be like, okay, there's not much we can do about that. That's always going to have a low risk. We can't get rid of that thing, and so it's just going to be there. They want to see that you're prioritizing those high risk things and then working your way down. It's not an all or nothing. It's not a it's that continual like little circle that the little guy had. They emphasize that framework third-party certifications are not substitutes. Even a high trust certification, SOC 2 certification, those are all popular things right now. Those things do not equal HIPAA compliance. They might help you and they might be in alignment with HIPAA, but it does not substitute. You can't come to them and be like, oh, I have SOC 2, so I'm good, right? They're going to still look at it and break it down, and they're going to want to still see a risk analysis and your risk management and see that you're actively doing it, not just relying on a certification from a third party. Again, ongoing function, not a one-time deliverable. We try to stress this to our clients as much as possible because we do, we go through your risk analysis with you, we give you our recommendations, and then a lot of times I think then the nice summary that we send just gets like put in a file folder in their email or on some shared drive, and then we don't talk about it again for a year, right? But that's really not the intent of the risk analysis. It is a living, active document, and really your business is a living, active thing, right? Your risk levels can ebb and flow throughout the year. As I mentioned before, if you add a new tool or a new vendor, new software, you should really be evaluating its risk level. You need to add it to your risk analysis. You need to add it to your data mapping, to your, possibly your inventory list. So that's how it kind of becomes an active thing as things come and go within your business. That changes your risk sometimes. Here's a summary of the summary, right? Because really, there was a lot in that video. I think it was like a 48-minute video. But here's kind of what I gleaned from it was everything should be documented. We already live in that space, right? With claims, coding, billing, document everything. It's the same with risk management. You want to have remediation decisions for identified risks. They also want to see that actual implementation of the safeguards tied to those decisions. So if you say, okay, here's our remediation plan, then they want to see the evidence of the implementation of it. It's that continual, thing of like, you can't just do one part of it and then stop. You've got to finish the loop out. And then again, that ongoing review of whether those safeguards are actually working. This is one thing I also bring in with like policies. Like, okay, create a policy, great, train everybody on it, great. But what happens when it's not working? Well, then adjustments need to be made. And that could happen with some of those safeguards or remediation things that you decide at the beginning of the year or whenever, oh, this is how we're going to remediate this risk. And then 6 months later, you reevaluate and you're like, oh my gosh, that remediation plan isn't working. It's not functional. Then you have to adjust. So they really want to see that. All right, I think this is our last polling question. How confident are you that you could hand OCR, your risk analysis, and your risk management documentation today and pass muster, right? Are you very confident, somewhat confident, not confident, or, oh, we've got a lot of work to do? No shame. This is always a safe space. Like I said, here at HCP, we've seen it all. We've seen the full spectrum of, you know, from very confident to, oh my gosh, I don't even know what a security risk analysis is, right? All right, I'll give you a couple more seconds for that because I do want to get to I knew this was going to happen. I was like, I have way too much stuff to go over today, but I want to get to that 90-day action plan. Okay, somewhat confident. Okay, not confident, very confident. All right, some people got some work to do, so let's get right to it. All right, 90-day action plan. Again, this HIPAA security rule being the rewrites being delayed. is not a grace period. It's a head start. And even then, I would say if you've done nothing up until this point, you might be a little bit of behind. So maybe it's not so much of a head start, but that's okay. We all got to start somewhere, right? Risk analysis, risk management, documentation. OCR expects to see all three of these. So here's what we're going to do. First 30 days, know what you have and what you owe. You want to pull your last risk analysis, check the date. Some of you guys already were aware of when was the last time that you did it. You want to build or update your asset inventory and EPHI data flow map. The data flow map does not need to be fancy. You don't necessarily need to go pay a third-party vendor to, put a nice pretty map. Put out a piece of paper and put the thing in the middle of where your PHI starts and put the little arms out of like, okay, then it can go here, it can go here, it can go there, it goes to these devices. That asset inventory is so important. Make sure you're considering everything that has PHI on it. Run that addressable versus required grid against your own environment. Look that up. You can go straight to the rule and sift through it. That's also a great place to Google, hey, give me all the addressable things and all the required things and see where you guys sit, see where you need to make some adjustments. You should also inventory unused software, legacy services, default accounts. That's a great place to start. Are all of your devices on a default admin password that everybody knows because it's the same default admin password? Well, then it's basically not a password at all, right? Next 30 days, you want to turn those findings into risk management, not just analysis. So let's say you did do a security risk analysis and you feel confident about that, but you don't feel confident about your risk management plan. So go through it, go through that analysis. Okay, what did we identify? Who's going to be responsible for the remediation? How are we going to remediate it? Anything you can't fix immediately, implement and document an alternative control. There might be something you're like, hey, we want to do this, but for right now, we can only do kind of a smaller thing because it's going to take time to get to actual control you want to put in place. Confirm those controls are actually configured, not just purchased. If you are on any of those Microsoft, Google, enterprise level things, I almost guarantee you they have not configured things for you. Find those implementation guides and make sure you have all of your shared drives, anything that you're using properly configured so that your PHI is safe. Again, NIST compliance is not enough. Document your own process. Document your security process. I'll say it again, document everything. That 60 to 90 days, so that brings us up towards the end of the year. You want to prove the cycle is working. So tailor your chosen security baseline to your actual environment. Again, NIST actually the OCR and did a whole crosswalk with NIST. So there's a whole thing that shows you how NIST and the HIPAA Security Rule align and where you can crosswalk the things together. That's a great place to start. List any system change in the development environment first. If you're going to make any changes, test it. Just make that part of your policy. Important thing to do is schedule your next full review cycle now. So if you're like, all right, we just went through our analysis, we made a remediation plan. Okay, put it on the calendar now when you're going to re-review things and see if it's working. Also, schedule that next full cycle review, right? Not just the little mini reviews you need to do, but okay, when do we got to do this all again? And then I would walk through what OCR requests first in any investigation. And that is, and I've probably said it multiple times, is that thorough risk analysis, make sure it's thorough, and your risk management plan. And you want to confirm that both would hold up. I want everyone to get to that very confident level. So go through those things and make sure that you are putting yourself in a good spot because this is what we want to see. Not the first person who is like, sitting back, like nothing to worry about. Get to work now because again, those expectations are already out there. They're not going away. You don't want to find out at the end of the story that you should have been paying attention the whole time to all of the signs and clues that you were given along the way. So please be proactive. Start working on those things today. And even in that next 90 days, make it a goal by the end of the year to start ticking some of these things off your list, not off the list forever, off the list for the moment until you need to review them again. Sorry, I went a minute over and I did not leave much time for questions. I don't know, Josie, if we had any questions that we need to address.
Yeah, I think we just have one. Can you see it or would you like me to read it?
Is it does having a laptop or iPad password protected constitute encryption?
Yeah,
It does not. Those are two different things. So password protection is one thing. Encryption is the actual data itself on that device being encrypted. So that would be even if someone gained access to your device, they wouldn't be able to read the data on it because it's encrypted.
perfect. I think that was the only question we had.
Okay, amazing. Well, thank you guys so much. As Josie said, she will be sending out the slides. Feel free to, I did not put my email in here. I usually do. I don't know what happened. But it's just nstately@hcp.md. You can also email Josie. You can go to our website if you have questions. We are happy to help. This is what we do. This is what we're passionate about. And we want everyone to feel confident in their HIPAA security program. So good. I think that's it. We can stay on maybe for another minute if there's another question, but other than that, that's all I got.